you feel perfectly fine. No pain, no fever, no visible signs. Until one day, you notice something odd. A lump, a growth, a sore that doesn't go away. What if that's your body trying to tell you something? What if that's HPV, human papillomavirus, making its presence known? In today's episode, we're diving into the actual symptoms of HPV in both men and women. Because even though HPV is often silent, it can speak, and when it does, it's crucial you're paying attention. Here's the most important thing to understand about HPV. Most people will never notice any symptoms. That's because in over 90% of cases, the body's immune system clears the virus naturally within 2 years. No signs, no problems, no long-term impact. But for some, the virus doesn't go away. Instead, it stays hidden, slowly causing changes to cells that may lead to cancer. And even if symptoms appear, they're often mistaken for something else or completely ignored. In women, the most dangerous types of HPV are the high-risk strains that infect the cervix. These are often caught during routine pap smears or HPV testing, not because the woman felt anything wrong. But when symptoms do appear, here's what to look for. Abnormal vaginal bleeding, especially after sex or between periods. Unusual vaginal discharge, thick, smelly, or blood-tinged. Pelvic pain, during intimacy or as chronic discomfort. Genital warts, small flesh-colored bumps in the vulva, anus, or around the vagina. Pain during intercourse. Cervical cancer, caused by HPV, is slow-growing, which is why early screening is so critical. The earlier it's caught, the better the outcome. In men, HPV symptoms are often overlooked not because they're not there, but because there's no routine screening like pap smears. That makes it even more important to know the signs. Here's what men should watch for. Genital warts, small or clustered bumps on the penis, scrotum, groin, thighs, or anus. Persistent sore throat or hoarseness, a potential sign of oral HPV, especially if you smoke or engage in oral sex. Unexplained lumps in the neck, which can be a sign of oropharyngeal cancer. Anal itching, bleeding, or pain, especially in men who have sex with men, a high-risk group for anal HPV. Non-healing sores in the mouth or throat. Again, most of these don't mean cancer, but ignoring them delays diagnosis if something more serious is developing. Regardless of gender, some warning signs should never be brushed aside. Growths or warts in the genital or anal area, sores that don't heal, bleeding after intimacy, chronic pain in the pelvic or anal region, changes in your voice, swallowing, or lymph nodes. These may seem unrelated to a virus like HPV, but in some cases, they're the only warning signs your body gives. Here's the rule. If you notice anything new, unusual, or persistent in your body, check it. Women should get routine pap smears starting at age 21, and HPV testing by 30 or as recommended. Men should seek evaluation for any persistent warts, lumps, or oral issues, especially if they're sexually active with multiple partners. HPV can be silent, but you need to listen when it speaks. In the next episode, we'll answer a question everyone asks after diagnosis. Can HPV be cured? What happens next? There's good news, but only if you take the right steps. So hit the like button, subscribe for more, and share this video with someone who might be ignoring the signs. Because sometimes, the smallest symptoms mean the biggest things.